everyone, it's Nilanjana here, coming to you with a video on urinary incontinence in women. What is incontinence? It's when you don't want to wee, you want to wait until you find a toilet, but you have wet yourself because your bladder could not hold the urine until such time as a toilet becomes available. So why is the bladder behaving in this way? There can be two main reasons. One is muscular and the other one is nervous. If it is muscular, as can happen with vaginal delivery, as can happen with age, as can happen with a few other conditions as well, then we need to do pelvic floor exercise to strengthen the muscles of the pelvic floor, to tone the muscles. I will post a link for pelvic exercises down below, and these have been found to have exceptional effect on the continence. Now the second problem here is the nerve situation. The brain and the bladder are connected, so when the brain tells the bladder, okay, now we have found a toilet, you can now relax your muscles, the bladder relaxes the muscles and we wee in the toilet. If the brain and the bladder are not listening to each other, then the bladder muscles will relax wherever and whenever they feel like. In order to re-establish this connection, we have to do what we call a bladder drill. So a bladder drill is you go to toilet at 10 o'clock in the morning, you tell yourself, next time I'm coming for a wee at 11:30. You go at 11:30 and then you tell yourself, I'm coming for a wee at 1 o'clock. So this way you try and establish or re-establish the connection between the brain and the bladder. Now both of these techniques or both of these systems have been seen to work really well. Obviously, if they don't work well or if you're having any other issues, then I would suggest you can consult your doctor, get a scan and some baseline blood testing, and then we can add tablets on top of this. So what I'm suggesting is you continue the bladder drill and the pelvic floor exercise and we add medication. And all three can work synergistically and give you a really good effect. If you require any further details on urinary incontinence, please do not hesitate to contact me. I will try and answer all your queries. Thank you.